everyone, and welcome back to another episode of 1 Minute Cups. My name is James Mitchell. This is Logan Sullivan, and we will be hosting today's presentation. First, to start off, we're going to be speaking about the history of 1 Minute Cups, followed by the actual presentation given to us by a special guest, Johnny. Third will be the Q&A, and fourth will be our. I will close it and wrap it up. Okay, so at the beginning, the 1 Minute Cups was created by the Ewing Marion Kaufman Foundation. Next slide. And the purpose of this foundation, as you guys know, was to help communities in entrepreneurship. They wanted entrepreneurs to take risks, to own their own success, and to ultimately be uncommon. They did that through 1 Minute Cups. Now, what is 1 Minute Cups exactly? 1 Minute Cups is a free weekly program that educates, engages, and connects all local entrepreneurs. It's a community in which entrepreneurs can have conversations with each other and just have different conversations about information pertaining to their businesses. The mission behind 1 Minute Cups is to lower the barrier of access to education and resources for all types of aspiring entrepreneurs throughout the United States. And they did that by creating a community. At first, it started off with one community in Kansas City, then it grew to 66 communities in January 2015, and then 103 communities in 2017, 163 communities in 2018. I think it's over 200 communities in 2021. With that being said, at each location, there is 1 to 2 presentations. Today, we'll only have one presenter, and this presenter will have 6 minutes to present, 15 to 20 minutes of Q&A for our audience. Next slide. If you want to join our community and follow us on our chapter, please visit us at www.onemakecups.com/Chico. With that being said, without further ado, I'm going to allow Johnny Crowder to the stage, and he will present his presentation.
Hey guys, thanks for having me. I live in Florida, so I do not live in your community, but I've done every 1 million cups that I can drive to, and now I'm doing a couple that I can't drive to, really just to get feedback on our go-to-market. So I'll touch on that at the end of the slide, at the end of the presentation. But quickly, while I pull up this screen share, I wanted to just kind of explain that I do work in mental health, but it's because I grew up in and out of treatment with a bunch of different diagnoses, and I went to school for psychology. This is a very personal topic for me. So if you are able to turn your camera on while I present this, it would make it a lot easier for me, because even though I share this professionally, it is a lot easier to share when I can see people's faces and feel that human connection. So what CopeNotes does as a company is we provide daily mental health support via text message. Fairly straightforward, but there's a lot more neuroscience and tech behind it that I'll get into that makes it really unique as a resource. The problem, if you're not familiar with the mental health industry, you probably don't have to be to understand that it's kind of broken. So it neglects people like me who spend years and years exhibiting symptoms of mental illness without engaging with treatment, because I was concerned about cost, accessibility, privacy, social stigma. I could give you a list of reasons why I didn't want to use any mental health resources at all, many of which came from the fact that for a long time I was undiagnosed. So I was like, if I'm not living with a diagnosis, then I don't need a mental health resource. So there's a lot of misinformation there, and I was judging myself. And by the time I did reach out to a provider, the providers said, we are underfunded and understaffed. Like, you can just get in line and we'll get to you when we get to you. Hopefully we can help. And as a result, a lot of communities are responding to crises rather than preventing them. So CopeNotes is all about prevention. We're trying to get there before the headline, before the tragedy, before the news story, and equip people with health education and skills that they'll need to face those difficult weeks, months, and years. So quickly, you will not find us on the App Store, and that's because not everything has to be an app in the 21st century. CopeNotes is all via text, like I mentioned, and some of those reasons are obvious, like why we chose SMS. Obviously, not everybody wants to download another app. You don't have to remember passwords. There are no software updates. You don't have to share your personal data with the App Store, and that's not shared with advertisers. So there are lots of benefits. But the main reasons why we chose SMS are engagement, preference, and equity. So on the engagement side, you are literally 25 to 50 times more likely to engage with a text message than you are with an app notification. So it was kind of a no-brainer for us. We had to choose SMS because it's just a way more effective method of communication. And on the preference side, a lot of people say, well, yeah, kids like to text, but what about us learned, intelligent adults? And actually, it's the same for you guys too. 97% of American adults prefer texting to any other method of communication. So not only is it more effective, it's also more comfortable for the average person. And I think the most important component here is the equity component. 11% of the US population uses non-smart cell phones. And for years, we've been creating mental health apps as an industry and then saying to 36 million Americans, sorry, you don't have a new iPhone. I guess you can't use this resource. And that didn't sit well with us. So we knew that we wanted to serve those tens of millions of Americans that need support but can't access it already through traditional apps. What CopeNotes does, like I said on the first page, we provide daily mental health support via text. But what that looks like on an individual text level is pretty cool. So all of the texts are written by peers with lived experience. So we have that peer support base. And then all the texts are short and conversational, easy to understand, and they're reviewed after they're written by peers. They're reviewed by a clinical oversight panel. And these are mental health professionals that ensure that all of the text messages are based on proven psychological principles. They are applicable across demographic, no matter who receives them. And then they are delivered at random times so that no two people ever get the same text at the same time. You never know when we will text you or what we will say, but you know that that text is designed to interrupt a negative thought pattern in your day and provide a catalyst for positive thought. And over time, that trains your brain to think in healthier patterns. Super fascinating. And then we encourage people to journal back and speak freely, kind of say whatever they want to say, whenever they want to say it. And journaling feels safe to the individual user. The reason why some people will text us a couple hundred times a week just to get stuff off their chest and vent and speak freely. The reason why they feel safe to do that is because CopeNotes is 100% anonymous and confidential, which means that right now, Christy could sign up for a subscription and I would have no way of knowing that she did. That's kind of the way we want to keep it. We don't collect names, addresses, or any personal health information. It really is anonymous. The neuroscience behind this stuff, I literally gave a TED talk about neuroplasticity and the science behind CopeNotes. That's how much I love this stuff. But to make short work of it, because I know I'm on a time crunch, the 6-minute thing, your brain doesn't actually care whether a thought is positive or negative. It cares whether a thought is comfortable and easy to think. That's the way it's biologically programmed. So all we're doing is interrupting negative thought patterns with text messages that will catalyze positive thought. And over time, your brain forms new neural pathways associated with that positive thought. I'm sure that you've read about neuroplasticity or brain training. This is exactly that. It's a cognitive restructuring tool, but it doesn't feel clinical and sciencey. It feels very casual and conversational and informal. So it helps the brain feel natural as it's making these changes. We have 3 subscription tiers. One is just for personal subscriptions. So like I could sign up for myself. We have gift and family subscriptions. So one of you guys could sign up coworker or your mom or get a subscription for your whole family. But really about 75 to 80% of our revenue comes from enterprise subscriptions. So that's with universities and school districts and city and county governments, hospitals, businesses, these large groups that say, we have to serve hundreds or thousands of people's mental health at one time, and we don't know how to do that on a budget. And CopeNotes is very budget friendly. A lot of resources out there charge $240 a month, $360 a month, $420 a month. And CopeNotes is right around $10 a month based on your preferences. So it is literally a full year of support through CopeNotes, costs less than 1 therapy session. Really important that we're cost effective because we are serving these larger groups. And the page that I'll end on so we can jump into Q&A is we do have a bunch of testimonials on our website. So if you go to copenotes.com, there's a reviews tab and you can click it and see what it's done in other people's lives. Really moving stories. We have over 100 enterprise level partners. So on the bottom, you'll see like Mental Health America, the state of New York, But really the most impressive thing in this entire slide deck is the fact that it actually works. We've collected feedback from thousands. We've served 21,000 users so far, and we've collected feedback from all of these folks, asking them what helps, what doesn't help, what did you like, what didn't you like, and 86% of subscribers report improved mental health within 30 days, which is just bananas. That's like double what we were hoping for. So yes, I'm passionate, if you can't tell, because I went to school for it. Yes, I'm passionate because I lived through it, but I'm also I'm passionate about this because I know that it's working and helping people every day. So I'm gonna jump to like the contact slide. So you have my contact information for a minute, and I'd love to jump to Q&A.
That's good.
Let's give him a round of applause.
Turn my sound on.
So we're gonna go to our Q&A. Thank you, Johnny, so much for your presentation. I want to start off by saying it was a really good presentation, very thorough, very brief, and it does look like you were passionate about CopeNotes. I do have one quick question. If you could just explain to the audience like your background and like how CopeNotes got started, that would really help us, narrow down like what it is and the origin.
So I want to clarify, I'm not a technical founder at all. So I have a chief technology officer. He's done all of like the programming and dev and security and stuff. I come from strictly the psychology side. So I went to school for psychology. I had been doing peer support through NAMI since 2011. So I'm like very familiar with the space. I've been in treatment, like I said. So I had been volunteering in mental health for years and years, seeing the gaps and feeling the gaps, becoming very intimately familiar with the shortcomings of our mental health system. And I was working in creative at the time. So like advertising, branding, copywriting, design. So fortunately, when I launched everything, I could like make our logo and make our website and do all the copywriting and stuff, but I had no idea what I was doing on the tech side. So I'm very thankful that I met Matt, who's our now CTO, who helped me identify a lot of weak points in our early prototype that just would have broken at scale.
So who's responding to the text messages?
Awesome question. We don't. So this is a digital journal. Actually, the first time you text back, we send you an immediate text that says, hey, just like it says on our hello page and on our welcome page, we won't reply when you text us, and it's actually healthier for your brain that way. So quickly, just to clarify, the reason why every therapist will tell you to journal is because journaling allows for self-report without positive or negative consequence. So like if you're my therapist and I share something and you nod, or you shake your head, or even you lean back in your chair, I can learn to change what I share and how I share based on external feedback, which is dangerous because it makes people inaccurate in their self-report, which means that they actually don't know how they feel or what they need because they're being conditioned to share a certain way. So this is a digital journal. We tell people, we're not going to give you a cookie for journaling. We're not going to wag a finger at you if you say something mean. This is a place for you to speak freely. And the reason why every therapist will tell you to journal is like the journal doesn't interrupt you. It doesn't pat you on the back. It doesn't comfort you. It is just there. And people need a place to share it. And that's exactly what that is.
Cool, thanks. Is the NAMI Association, are they using this tool as a whole, or do you have to approach them? Because I know we have an office here in Chico. So I was just curious to see when their logo is up there, does that mean that they are all associations using this as a tool as a whole, or?
We've contracted with maybe 6 or 7 different affiliates so far, and we're still growing. So we would love to talk to the Chico affiliate. We don't have a relationship with them currently, but it started with just the local NAMI that I was volunteering with, and then it just grew and grew.
Okay, thanks.
So when you said you have a $10 a month thing, and that's not enterprise-wide, that's per individual, right?
Correct.
Yeah.
So yeah, if you were going to support 100 people or something, it would be like roughly $120 per license.
Yeah.
Johnny, I just want to say you're clearly passionate about this idea. I guess my question is, how long or when did this come out, CopeNotes?
So CopeNotes we sent our first text message March 1st of 2018. So we're almost 4 years old. But I ran a beta version of this called Not a Therapist for about a year prior. And that was a peer support resource that was fairly different. Like you could choose all these different, here, let me turn off my screen share. So Heather, you were saying like who responds? We used to offer that. So Not a Therapist was like a real-time communication platform, whereas CopeNotes is asynchronous. And when we were running the real-time thing, people complained. They were like, I don't like having to have an appointment or to feel like I owe somebody a response or anything. So we learned a lot of hard lessons in the beta version of CopeNotes. We had maybe, I don't know, around 200 people use Not a Therapist or so over the course of a year. And they gave us a lot of great feedback. I say feedback, but it's more like criticism about what they didn't like. And then CopeNotes is the more cleaned up version that integrated a lot of their feedback.
That's very cool. Yeah, because I was going to say, most services like this, they are a little bit different in the sense that I guess the best way to put it is, you can, it's just, I don't know, it'll come back to me. I'm sorry about that, James. Did you have a question?
Yeah, it was mainly about the results, like of how you call it. So like, I remember in the beginning you had mentioned to us, Johnny, like that you wanted like human connection just by everybody turning on their cameras and just because I guess maybe your background or whatever. But I'm trying to relate that to kind of CopeNotes in the same sense. What do people want a human connection mind? What do people want to know, like their face behind somebody that's messaging them? Besides just a text message, I'm really curious about like just the results. Have you gotten any feedback just regarding that? Like,
So if someone is like in real time, like if they are in need of real time support, like if they're in crisis or something, we have a partnership with the crisis text line and they can support somebody in real time. It's just something that we don't do. So we are very clear, like we don't offer that, but our partner does, and we're happy to connect you. So we have that base covered. I have found that a lot of modern resources that are real-time communication or even asynchronous will rely on like a chat bot or like an AI thing that tries to piece together sentences. I don't know if anyone has used one of those, but it really does not feel human. It actually is really alienating, especially if you're seeking support and you get a text that's clearly written by a robot. At least I actually serve on a board for a research study that is researching chatbot for mental and emotional support. So I'm very familiar with like how people respond to AI versus how people respond to text written by real individuals. And I think while you can't see a picture of the person who's texting you, you do know that every text you receive through CopeNotes was written by a real peer with lived experience, like someone with firsthand experience going through something similar, and they're only speaking from that personal experience. So what we've found through feedback is people are saying, I like that it's anonymous and we can't see each other and hear each other's voices, know each other's names. But I also like that I know that it's a real person and not a computer.
Yeah, I was going to say, I like how you add these, you're clearly passionate and you can realize these underserved needs, within your target market because, you're part of the target market itself. And I guess the question is, are you still finding things out like this even now to change, the way your system goes?
Dude, we have literally every day CopeNotes changes and grows. So what's really cool about building a system like we did is we have a built-in feedback loop. So basically, let's say we send a text to Gunnar and he responds and says, this one's stupid, or this one doesn't even resonate with me, or I don't even understand what you're trying to say. The wording is confusing. Any type of feedback is relayed anonymously to our clinical oversight panel. And then our oversight panel can revise the text message that triggered that response to incorporate that feedback. So that's happening on a macro level constantly. We have a text library that is growing and changing hour by hour based on user feedback, which makes it like this living, breathing library rather than this kind of static, like, I wonder how people feel. Like, people are texting us how they feel all the time, and we're making improvements daily based on that.
That's very cool.
So what are your next steps and what do you need?
Well, we are poised for growth, but we're also bootstrapped. So what we really need is like a very intelligent, stunting on a budget go to market. And part of the reason why I'm doing 1 million cups to collect feedback from people and to like hear from people is specifically around our go to market. So for the first however many years, so like for 3.5 years, all of our sales have been inbound. Like, people, county administrator in this county talks to a city official in this other city, and then they talk to a school district, and then they talk to a business. So lots of word of mouth, lots of press that has driven people to request contracts from us. But we've never really done like a formal outbound sales strategy before. And so now we have a couple salespeople that we're like in the middle of, or towards the end of onboarding for them. So they're finally getting out into the marketplace and experimenting. And from where I'm sitting, I don't know, because we're on a limited budget, I don't know whether our finances and time and effort are better spent on like a really top tier marketing effort that will drive like top of funnel inbound and like nurture people through email sequences and landing pages, and social ads and stuff like that, like more of an automated hands-off like pre-qualification kind of thing. Or if we are more of like a traditional healthcare SaaS model where cold calls work and email campaigns work and like people doing like a traditional outbound sales strategy. And right now, I understand that eventually I'll probably have to do both, but right now, at least financially, as a bootstrapped company, we kind of have to triage and choose a priority. Like, either we're gonna go hard on outbound, or we're gonna split and like have half the outbound sales efforts in order to supplement marketing, or we're not gonna do any outbound at all and just do marketing and handle inbound. So that's the hard part for us to figure out right now.
Yeah.
Well,
I come from a convention background, so this is always the first thing in top of mind when I attend these things. And obviously, we haven't. Most conventions have not been happening, but I don't know if you guys have thought of promoting yourself at those targeted mental health, hospital, healthcare, in the near future when that industry is opening again, obviously, which it's starting to slowly. I know San Francisco has started, Moscone Center has started their convention.
Really want to get back into that because my advocacy career started with public speaking. So I'm like a keynote speaker, and I will speak at conferences about
Okay.
healthcare and mental health and entrepreneurship and all this stuff. So often, as part of my contract to come speak, they will allow me to set up a table, and that's been like an amazing opportunity to get this in front of like healthcare systems and governments and stuff. So once, you can imagine, it has been challenging virtually, because when I'm speaking virtually, I don't have a table. I'm not milling around with other attendees. I just get on stage and I get off stage, and it's kind of the end of it. So now that conferences are coming back and I can actually spend a few days at the conference center with people, with a couple of salespeople with me who are nurturing relationships, I can't wait to get back to that.
Yeah, I was in a convention in LA in November, Thanksgiving, and they were requiring proof of vaccination status, and you had to wear masks and everything. That makes it really tough even now. But one of these affiliate marketing things I've been looking at, he was an alcoholic, and the kind of questions he was searching for before he got treatment were like, how do I know when I'm drinking too much and stuff like that? And you can get those search query responses for a song compared to like rehab which would cost you like many dollars for keywords and stuff like that. So there's ways of finessing the like a blog. You could get a lot of traffic for keywords that are not competitive. So the difficulty would be low to win for those. Just you might research doing that. I don't know if you deal with substance abuse or what a lot of your people are doing.
That's really cool. I don't know enough about SEO, if I'm being honest, and we're actually like trying to learn more and potentially work with like a marketing firm or something that can help us with like paid search, experiment with paid social, just try to see if there's any fruit there. Because right now we don't know, and I think it's worth looking at. Only like you said, we'd have to get really competitive because we're a sole source provider, so we have no direct competitors, but we do have indirect competitors, and those folks have like $100 million marketing budgets because they're massive. So we need to get really sneaky with like our.
You have to go around. You have to do an end run on them. You can't just say, "Hey, join our rehab," because that would be like $100 a click type of thing. Yeah. Whereas, "Am I drinking too much?" might be a nickel. That's the kind of thing. Affiliate marketing dude is a guy on YouTube that I'm looking at for counseling on how to like not go broke. You might check into him, see what he's doing.
Thank you.
Hey Johnny, can you hear me?
Mm-hmm.
Okay. So one of our organizers who's supposed to be here, she's not here right now, but she's watching it through her phone right now, and she says, this is amazing. She loves, what you're doing, but she also wants to ask a few questions. So like she wants to know how many employees do you have already? How many universities have you like partnered with, or like have done, or one planning to do business with, and how are you funded? Those are the three questions she asked.
What was the last one? How are we funded?
Yeah, how are you funded? How's the funding process going on? You said you were bootstrapping in the beginning?
Yeah, so we have raised no money, in large part because I had no idea what I was doing for the first couple of years and know that I could do that. And then by the time we actually started having conversations with investors, we were doing enough in revenue to not take outside capital. So I'm not super closed off to outside capital. I'm also not pursuing it. I'm confident that like right now we're running the company off of revenue, and it's not, I don't drive a Lamborghini or live in a mansion or anything like that. It is still very much a challenge, but we're out of like starvation mode. So right now we have 5 full-time W-2 employees. We have 9 part-time or contract folks. And then we have our clinical oversight panel who's like outside of that. So, and they're not as involved on a regular basis. I mean, not all, because there's like 20 something of them. So they're not all doing everything all the time. They're like some main people that are holding it down. And then everyone else is more on like a review. So I would say all in like 5 full-time, 9 part-time or contract. And then the COP is like 20 people who are like floating in and out and pinch hitting for each other. It's more fluid. What was the other? There were 3 questions.
It was how many
employees you have, but are you partnering?
contracts?
Yeah, are you partnering with any universities at the moment, or is that is that an option that you wish to like tackle on as far as partnering with colleges and universities or working with them?
We really want to work with more. One of our first enterprise contracts ever was with the University of South Florida, USF. And then we had a couple other contracts that were unfortunately halted because of COVID and budget cuts and stuff. So we know that CopeNotes can make a great impact on college students. In fact, we are in data collection for a quantitative study with USF Health right now that is specifically geared towards college students and staff, like educators. So I know that CopeNotes can make a positive impact on that demographic. We just, when COVID hit, everyone like sort of grabbed their purse strings and were like, we're not spending anything. And I'm like, oh no, this is like the time when mental health support could be really valuable. So we have worked with only one paid university before, and then we have a couple others that have been paused because of COVID, but we know that it can work. So if you guys know of any university folks that I could be connecting with, please let me know.
Yeah, of course. Oh, go ahead.
Oh, I was just looking at all your shoes. Maybe think of the professional sports industry. I mean, obviously you need to hone on what your target markets are, but it just occurred to me looking at all your shoes that, oh, the professional sports arena would be, you know, because it is confidential. It's, you know what I'm saying?
Oh yeah, and the NFL just launched this like big mental health campaign like
Yeah.
this week or last week or something.
Mhm.
So it now would be a wonderful time for us to start partnering because I think they're realizing they can't keep like stuffing it down for too long. They have to acknowledge it. So
Yeah,
I'm very interested in pursuing that as well. Even on the college level,
Yeah.
like those
for sure.
students under so much pressure. It's like
Yes, anxiety and
I think closer here in California, well, of course, they're going to talk to you about Chico State and Butte College, it's our hometown. But San Francisco, UC Med Center, UCSF Medical Center, they probably have a psych department that might help, want to be interested in therapies. So,
Yeah, that's definitely a good one for sure. UCSF or yeah, USF.
yeah, my wife used to work there in the medical center, so I kind of familiar with.
I mean, you've got some big target markets there for sure. It's just like you said, it's just putting them in the places and the people and the
Yeah, the hardest part so far has just been raising awareness. Like I do speak out quite a bit. I do a fair amount of like press and thought leadership around mental health and stuff, which helps. But it's not sustainable at scale. Like we need a real replicable system, whether that is fully automated through digital marketing or
Right.
whether it's like real AEs and SDRs like pounding the pavement, hitting the phones and just getting in contact with people. And right now we're like, all we care about is that more people find out about CopeNotes. We just need to do it in the most cost-effective way right now.
Mhm.
So just one more question for me. So overall, as what you're saying is like you guys need a go-to-market plan, but you guys are currently onboarding sales and marketing, so that's kind of getting fixed right now. My last question is probably gonna be my final question. Where do you guys see each other? I mean, see CopeNotes in, I don't know, 1 or 2 years, or as far as like acquiring users or just maybe just revenue possibilities. Like, where do you guys see yourselves in like a couple of years from now?
I'm a fairly ambitious person. So I completely overshot what I wanted our revenue to be this year. And the year's not over. So I'm still confident that we can pull some magic off. But there's in terms of revenue, in my mind, there's no reason why we should close next year with less than $1 million in revenue. I also would like our team to be at 10 full-time by next year. We already have like kind of a talent roadmap of people we would want to hire and when. We just would need obviously the revenue to make those hires and commit to paying them. And then user base, we always have really outlandish goals. I'd really like to hit 100,000 users next year. I understand that, we're at like 21,000 right now. So that would be pretty significant growth, but I am ready for significant growth. And then as far as like where I see us strategically, we've always been a gap filler. So I don't see us as like coming into the mental health industry and like shutting down all these therapy offices and replacing. No. We're not replacing crap. We're filling a gigantic gap in the mental health care industry that is making every other vendor suffer. Like people don't go to therapy because they're judging themselves, or people don't engage with a mental health resource that is smartphone dependent because they maybe either don't have a smartphone or they don't like the idea of themselves being on camera or whatever. So all we're doing is coming in and filling those gaps and hopefully driving engagement with other resources. Like if someone doesn't want therapy now, will they be open to it after 3 months of CopeNotes? That's really like the gap we're trying to fill. Can we help support other vendors and be that like plug and play partner rather than coming into like completely upended industry? Because to be frank, I don't give a crap about the industry. I care about the people who are being neglected right now. So my focus is less on like disrupting the industry, and more on like taking care of the people who are not being taken care of right now, which I think would make us a tremendous partner to literally anyone in the funnel. Like if you're talking a hospital or healthcare system or an insurance payer or a benefits broker or even like a private practice therapy, we can partner with all of them. So I think over the next 2 years, our real strength is going to shine when it comes to like real community partnerships with governments and agencies and hospitals and things like that.
I know that for physical medical care, I have like 3-month appointments for a disease and
Wow.
diabetes, but in between that, the only text messages I get are from CVS, your prescription's ready. So yeah, they could probably, I don't know if the same is probably true in the psychiatric or whatever, I don't know, behavioral services industry. So, you got a long gap between the next appointment. Be nice to get some encouraging things other than pick up your meds, your Prozac's ready.
Yeah.
And who's doing your marketing now in social media? Are you doing that, or do you actually have somebody that's part-time doing that? Or I forgot to ask that question. Maybe you addressed that already. I'm sorry.
I have done everything, which is a terrible system. It's been a lot of fun because I like doing creative, but we just hired an account manager and like customer success person, Adrian, and she is slowly picking up a little more of the social media stuff. You will notice that if you look up CopeNotes on social media, you will see almost no posts. We are responsive for like messages and stuff, but we don't really post much because our whole like content situation is like you need to sign up so that we can text you. We're not going to like make a whole, we're not trying to make social media content. We're trying to change your life, and we have to do that via text message. So for a long time, we haven't invested in socials. Moving forward, we're probably going to work with a firm or someone who can do that, because it would take up an inordinate amount of my time to do it myself, even though I kind of.
I mean, I'm just thinking, just from an Instagram standpoint, just, the stats that you provided in your slide deck.
Yeah.
Like sample text messages that are, everything that was in your slide deck could be those posts, how you would run with it, right? Yeah. People are like, oh, anyway, that's just kind of where my brain went. But I think that would actually be very beneficial for you guys. You just have to take the right angle on it. And I see Emily's on. She's our social media intern guru here at Chico Start. Hi, Em. I thought maybe she's going to give her 2 cents.
Yeah, it's hard to be anonymous when you're doing Facebook friends. Have their names on them.
Yeah, I definitely from the marketing standpoint, one of the things that was really intriguing to me, because I did actually look up your socials. It's the first thing I do every single time I see a new company, which is actually quite common for my generation as well. And yeah, there virtually is no post. One of the things with that as well is for these younger markets, like if you are trying to go more towards universities or kind of that millennial generation, this is so big of a market for them. And social media is, although the prices in the beginning can be quite demanding, especially if you're bootstrapping currently, it is so much more worth it in the long run, because not only are you building brand loyalty with, millennials through social media, they are then sending it to their friends or posting it on Facebook, or a $25 one-time Instagram ad can get you 5,000 different new potential customers. So yeah, I definitely back Heather on that as well. I think that would actually be a really great opportunity for you. And one of the Instagram styles right now that's been really popular is like a lot of really big health and wellness pages, and pages that, are posting affirmations daily or are talking about mental health, since it is a really big issue right now. So I think that even if you just post 1-2 times a week, I think that it could exponentially grow your company.
Emily, if you have a portfolio or the bandwidth to on something else. Because I'm not even joking. I was talking to Adrian this week about how we do need to make some sort of like concentrated effort into investing in that. So if you do have anything you would want to send me about even if you have time, I don't know what your schedule is like, but I'll just put my email in the chat. And if you are like, this sounds cool, or you know someone who would be interested, please let me know, because it's something that we'd like to pick up in January is the plan, like actually have like a planned social media calendar. Because I used to do this. I used to run social media channels for like Kevin Hart and Shaq and Bam Margera. Like I worked at an agency who did that. And I got so burnt out on it that when I started my own company, I'm like, screw it. I don't want to do it. I know that it must be.
Well,
It
that's
is
why
stressful.
like amazing, because I love doing it. I can spend my time on Instagram and TikTok all day long. So I'll definitely let you know.
Heck yeah.
Awesome.
All right, we'll wrap it up.
Yeah, I don't mean to cut you guys off or anybody, but if anybody has more questions, now's the time to say it before I wrap it up.
I just want to say thank you for being here, Johnny. I think this is an awesome platform for people. And I love how you're so genuine, and your goal is to reach out to those people that are unserved. So I'm just really impressed, and I wish you the best of luck. I really do. What I used to work with the chamber here. And so I know Nami was a chamber member at one point. So and that was a while ago. So I'm not sure who, the executive director or whoever runs the local office, but I'm going to try and reach out to them, and little steps, right? Any little piece helps. So
Definitely.
yeah.
Please.
Well, yeah, we're gonna wrap it up. Let's give a round of applause to Johnny Carter. Man, thank you so much for coming out and showing us some love to us here in Chico. And I'm about to wrap it up. I'd like to thank Eva Shepherd as well as Logan O'Sullivan for hosting this presentation with me. I'd also like to thank our community sponsors, Morgan Stanley, Chico Start, Grow Tech, Global Entrepreneurship Network, T-Bar, Build.com, Startup Grind, Explore Boone County, and last but not least, our favorite place, Doble Coffee. And for our community, actually for our audience, please join us every Wednesday at 9 a.m. on Zoom. Next week, we will have a Changemaker Institute, and they will speak about what they do as far as their organization. And for anybody that wants business resources or business help, or wants to listen to workshops or come to our 1 Minute Cups, please sign up for our Chico Start newsletter. We have all that information in the QR code if you would scan it with your phones. Thank you again, Johnny, for showing up, and hopefully we'll see you sometime soon, or maybe in the future.
Thank you all so much for having me. And Emily, I wasn't joking. Please hit me up if you're available. Thank you guys.
Thank
All right,
you.
see you.
Have a great night.
How are we going?
Bye, y'all.
Bye.